We've all heard of mercury, antimony, arsenic, lead, aluminum, and cadmium. Well, our food supplies, our personal care products, and our environment is contaminated with these heavy metals, and they have deleterious effects on our health. I see many medical conditions, people coming in with multiple sclerosis, neurodegenerative diseases, chronic fatigue syndrome, fibromyalgia, and I find heavy metals are an underpinning for their illness. And so what can we do? We're all exposed to these things, but what can we do about them? Well, I have done many things over the years, but I still fall back on my tried and true therapies because they are the most effective. So there are natural chelating agents, but there are also pharmaceutical chelating agents. And most of the people that come to me are sick enough to where their condition warrants chemical chelators. So I use a few different chemical chelators. One is DMPS, which has a high binding affinity for mercury, antimony, arsenic. And then I use DMSA, which is an oral chelating agent that has high binding affinity for mercury, antimony, arsenic, and lead. And then I use intravenous EDTA, which has a higher binding affinity for lead, cadmium, aluminum, and a few other metals. So I like to use these chelating agents both diagnostically and therapeutically. So I do what's called a provoked urine excretion test. I will often combine DMPS and EDTA, and I will give them one after the other intravenously. And then I collect a patient's urine for 6 hours after receiving that and measure how many heavy metals are pulled out of the body through the kidneys into the urine. And then based on the level of heavy metals, then I will prescribe an oral protocol for those patients. Usually it's a 3-day on, 11-day off protocol. I'm combining the chemical chelating agent that I'm prescribing with some detox supportive nutrients, and then on the off days, resupplementing healthy minerals. And then I'm doing, let's say, 6 cycles of that, taking about 3 months, and then I test them again. And generally speaking, I see progress happening over time, both in the numbers and in the clinical condition. This is often not the only thing going on with people, but it's an important factor that's an underpinning in many serious health conditions, and it does need to be considered.